everyone, it's Jane Rachel again, and I'm back with Kristen. And this time we're going to talk about vaginismus, which is a type of pelvic floor dysfunction. So Kristen, what exactly is vaginismus?
So vaginismus is when the pelvic floor closes up, and it can close up at certain times during your life, and you may have it when you're younger, or you may have it later in life because there's certain things that happen with our health.
It sounds painful.
It can be very painful.
And what type of things cause it?
So it tends to be something that needs to be very much talked about, and sometimes you need a psychotherapist to help you, or specific a sex therapist to help you kind of navigate the situation. But I kind of help on the physical end of it. So it can happen for a number of reasons. There's like primary vaginismus and secondary vaginismus. So primary vaginismus can happen where you can't use a tampon, you can't undergo a gynecological exam, and you can't have penetrative sex.
Because it's too painful, or
It's too painful and the wall literally closes up.
Totally closes up.
Yes.
Okay. And the reasons for that, are they more psychological, or is it?
No, you can, some of it is psychological. You can have anxiety, and when you're about to have an exam or about to undergo intercourse, you can tense, and all those muscles can tense too. But also too, there's also a cultural influence where sex is so taboo that when you're at that point, you may be too nervous to continue with that.
But are there sometimes physical problems that are not related
There
to
are
like
physical problems.
Like what? Like what?
So trauma.
Okay.
And
like physical trauma, because I'm thinking mental trauma, like if you've been priorly sexually abused, but physical trauma.
That's definitely
Okay.
one of a different cause.
Okay.
But you could have trauma where you have an injury to your pelvic floor.
And how would that happen? Just a car accident or
Not
childbirth?
exactly
or
a car accident, but say you're hopping over a fence
Okay.
and you fell.
Can you like give me like any sort of case examples or patient stories? Obviously, not using anybody names of someone who had this and like that you maybe treated and got better.
Yeah, unfortunately, if someone has had a history of cancer and they undergo chemotherapy and radiation in around that area, it can actually create the muscles in that area to atrophy, and it also affects your hormones as well, so there's not enough lubrication.
So what is like, let's say you saw a patient like that in your office, what would you do for them? Or like, do you have any examples of someone who had that and got better?
Yes, so my patients are able to use tampons again, have sex again, have an exam, and everything's okay.
That's really great.
But yeah, it's
how long
great.
did how many visits do they have to? It's not something where they come in once and they're better, right?
No. It takes quite a while. So, and it does, working with a psychotherapist is actually very helpful. It's a 50-50. It really has to go hand in hand.
So you're saying both, like the physical therapist and the psychotherapist.
And it's really important that we communicate as well about that too.
And in most cases, is it like treatable? Do most people get better when they do go through both the
Yes.
physical therapy and the psychotherapy? Well,
Yes.
that's great. So again, anybody who's pain, it sounds like pain in sex is not normal.
Mm-hmm.
So that anybody who's experiencing that should see a doctor, and if you're in the New York City area, see Kristen as well at Fem First Health.